Hello, everybody. Welcome back again to another session of one question a day. The question that we are going to discuss is the morphology of lower first molar or mandibular first molar. Question could be asked in many ways, but often very repeated. As usual, we go into the introduction. The initial permanent tooth to erupt. The salient feature is the first initial permanent to the erupt, and it is sixth in the midline. Distal to the mandibular second premolar is the largest of all the tooth, also called as 6-year molars because it erupts into the oral cavity by 6 years, hence called 6-year molars. It is also believed to be the cornerstones of occlusion in the mandibular arch. And then you proceed to describe the tooth numbers both in the in three systems: the universal, FDI. Universal right side is 30, left side is 19, the right side in FDI system is 46, 36, and the palmar notations. Then you proceed to write about the chronology, when it is the first evidence of calcification around birth, enamel completion 2.5 to 3 years, tooth eruption is by 6 to 7 years, and root completion 9 to 10 years. Then you proceed to write the dimension. Remember, based on the dimension, we say that the first molar is the largest and the strongest tooth in the lower arch, exhibits 5 functional cusps and 2 well-developed roots. The salient features include that it is wider mesiodistally than buccolingually, and the mesiodistal dimension is the greatest among all the tooth in the oral cavity. Mesiodistal dimension is the greatest among all the tooth in the oral cavity. The crowns are relatively short. As we proceed from anterior to posterior, the crown height becomes subsequently lower. From the all aspect, it is more or less trapezoidal outline like your maxillary molars. And in that is in the buccal and lingual aspect, whereas in the proximal aspect, it goes slightly towards a rhomboidal form. The function is grinding. The buccal surface going is the largest lateral surface of any tooth in the oral cavity, trapezoidal and outside, with the greatest mesiodistal width occurring at the occlusal surface. And all 5 cusps are seen, at least one part is visible in the buccal surface. The mesial outline is slightly concave from the contact area cervically and convex occlusal to the contact. So we have a concave from contact area cervically. This area is concave, whereas this is convex. The height of contour of the mesial outline is located at the junction of occlusal and middle third. The distal margin or outline is generally more convex than the mesial outline. In the occlusal portion, it is slightly rounded as compared to the concave margin of the mesial side. The height of contour is found at slightly more cervical location than of the mesial margin, but it is still at the junction of the occlusal and the middle third. The cervical line is slight but regularly curvature apically and sometimes displays a prompt, sharp pointed projection over the bifurcation area. Sharp projection over the bifurcation area. The occlusal outline. The occlusal margin is wider than the outline at the cervical. It is divided into 3 portions by 2 grooves. As they pass on to the buccals, they are the mesiobuccal groove and the distobuccal groove. So 3 cusps are seen. Okay, what are the cusps? The mesiobuccal cusp, distobuccal cusp, and distal cusp. Okay, and all of them end in a pit. The mesiobuccal developmental groove, distobuccal developmental groove end in pit, and we have a buccogingival ridge. Buccogingival ridge. This is a very rare phenomenon. They are not always present in all tooth. From the lingual aspect, these are the tooth that, so trapezoidal 5 cusps are seen, flat buccal cusps, lingual cusps are higher, so all 5 cusps are visible. Mesiobuccal development group and distobuccal development group are present, dividing the tooth into 3 cusps: mesiobuccal, distobuccal, and distal. Root is, the mesial root is mesial than the distal curvature, Distal root is less curved and more straight. The root trunk is about 3 mm, after which there is a bifurcation. The root trunk is about 3 mm. So all these has to be mentioned, and then the root developmental depressions are seen. The lingual aspect we proceed is also roughly trapezoidal and longer parallel side of the trapezoid at the occlusal surface. Wider mesiodistally at the buccal and mesial surface taper. The tooth proximal surfaces are also seen from this aspect. Lingual surface is smaller than the buccal surface. Mesial outline is convex occlusally from the contact area, which is the crest of curvature, and located at the junction of the occlusal at the middle third. The contact area cervically, it is concave. The contact area cervically is concave. The distal outline, the distal margin is completely convex. The cervical line is shorter mesiodistally and located at a more occlusal level than the buccal surface, with the irregular or nearly slight. But again, there could be a slight projection in the bifurcation area. The occlusal margin, the occlusal outline is broken by the lingual developmental groove. Remember, it is not 2 but 1. But the other grooves from the other sides could be visible. Mesiolingual and distolingual cusps and a small portion of the distal cusps are visible in this aspect. The outline of the mesiolingual cusp is slightly wider than that of the distolingual cusp. The two lingual cusps are more pointed than the buccal cusp, and they are approximately of the same height. And the lingual cusp ridge and the two lingual cusps are convex. So with that, we come at the end of the discussion on the lingual surface. Trapezoidal mesiolingual cusp is larger than the distolingual cusp. Part of the distal cusp is seen contact area, then lingual developmental groove, and all other things as we discussed. Describing the root, two roots are seen. Root trunk is about 4 mm. Developmental depressions are seen. From the mesial aspect, mesial surface is said to be more or less rhomboidal in nature, but the surface is wider cervically than the occlusal part. The crown displays lingual inclination, slightly lingual inclination. And this is unique to the all mandibular posterior tooth, and only two mesial cusps are visible because they are larger. The buccal outline or buccal margin is usually convex from the gingival to occlusal, but most convex at the cervical third of the curvature. Cervical third of the curvature. Especially if the tooth has a buccocervical ridge. The lingual outline is often straight or slightly convex from the cervical margin to the height of the contour in the middle third. The cervical margin CEJ may either relatively be straight or slightly curved occlusally. The occlusal margin is concave and is composed of mesial marginal outline, and you see the mesial cusp ridges of the mesiobuccal and the mesiolingual cusp. Mesiobuccal and the lingual cusp and the mesio-marginal ridge. A mesial marginal groove often is present. Mesio-marginal groove. So that brings us an end to the discussion on the mesial cusp. All discussed. Distal aspect. Again, draw a neat diagram. We're going to say that it is also similar to the outline of the mesial, rhomboidal. Buccal margin is similar to that of the mesial, except the concavity is sometimes present in the middle third is not evident. It's more or less flattened. The lingual outline is more or less a replica of the mesial surface. Cervical line is relatively straight. The crowns are shorter. Because of the shortness of the crown, all 5 crowns are visible, and we see what we call it as distal marginal ridge, and a groove running across is called as the distal marginal groove. Then most importantly, the root, distal root is seen from this aspect. The distal surface is smooth but sometimes present with the developmental depression if there is a prominent third molar. Next, most importantly, we come into the occlusal aspect. Is pentagonal in shape. First point is pentagonal in shape. Then The grooves with 5 cusps show a Y pattern, roughly a Y pattern. The distal portion of the buccal outline tapers the lingual to create a fifth side of the outline. The crown is wider mesiodistally than buccolingually. Right? The buccal outline is separated into 3 sections. The buccal is divided into 3 sections by the 2 buccal grooves. The relative length of the 3 portion decreases distally. So that the mesiobuccal is the longest, distobuccal next, followed by the distal. Mesiobuccal largest. So we have mesial, distobuccal developmental grooves. So the lingual outline, the lingual margin is divided into 2 slightly convex sections by the lingual developmental groove. Mesial portion is larger. And the mesial outline is divided into 2 approximate equants by the mesial marginal groove. Mesial marginal groove and distal marginal groove running across the mesial and marginal ridge. We have 5 cusps. All are functional. Distal cusp is the smallest. Mesiobuccal cusp is the bulkiest, longest of the 3 buccal cusp. Buccal cusp, it has buccal cusp ridge, lingual cusp ridge, mesial cusp ridge, distal cusp ridge. The distobuccal cusp is the smallest of the cusp, buccal cusp, rounded tip, has 4 cusp ridges as the names. They are the buccal cusp, lingual cusp, mesial cusp, and distal cusp ridge. The mesiolingual cusp, along with the distolingual, the mesiolingual cusp is the longest and sharpest of the cusp. It is second in size to the mesiobuccal cusp. The first is the mesiobuccal cusp. So we again have the mesial buccal cusp, lingual cusp, mesial cusp ridge, depending where it runs. The distolingual cusp is quite sharp but smaller in size. The distal cusp is the smallest of all the size. This is the order: mesiolingual, mesiobuccal, distolingual, distobuccal, distal. Mesiobuccal is the largest. Distal cusp is the smallest cusp, relatively sharp, again with 4 cuspal ridges. The height lowest from highest to lowest, mesiolingual and distolingual are same height, followed by mesiobuccal, distobuccal, and distal. Bulk is mesiobuccal, followed by mesiolingual, distobuccal, and distal cusp. The transverse ridge, no transverse ridge here in the first molar. Marginal ridge, mesial and marginal, distal marginal ridge. There are additionally triangular ridge and cuspal ridge for every cusp. Okay, the grooves are the central developmental groove, mesiobuccal development groove, distobuccal groove, lingual developmental groove. There are a lot of other supplemental grooves. The fossa is central fossa, mesial triangular fossa, distal triangular fossa. Pitch, central pitch, mesial pitch, distal pitch. Two roots, mesial root and distal roots, pulp canals, 3 root canals. The functions: anchorage and largest mandibular teeth. They are broad bifurcated tongue, superior anchorage and greater efficiency. This is the buccal, lingual, mesial, distal surfaces diagram with all the salient features in single frame of the mandibular first molar. To begin with, the buccal surface, right? We have prominent buccal surface, the mesial outline, distal outline, 2 roots, and 2 cusps, or rather 3 cusps to be factored, right? And the outline is, we have nearly a straight cervical line with a cervical dip at the center. Along the mesial outline till the contact area, which is at the junction of the occlusal to middle third, somewhere here, broad area, it is a straight line, after which it becomes convex and forms the large mesiobuccal cusp. Then after, the distobuccal cusp is formed. Then you see the third lingual cusp, which is the smallest of them, right? And it forms till the contact area where it is slightly around the middle third.
then forms a straight line. So it is a straight line, convex, mesiobuccal cusp, distobuccal cusp, distal cusp, then straight line. These three cusps are divided into their entity by two developmental grooves, namely the mesiobuccal developmental groove that ends in a buccal pit. Then the distobuccal developmental groove that divides the distal cusp in the distobuccal cusp. Here convex, straight. So straight, convex, three cusp, convex, straight. Distinguished by two cusps, mesiobuccal developmental groove and distobuccal developmental groove. The mesiobuccal developmental groove often ends in a buccal pit. Then we have near the cervical ridge a prominent cervical bulge. Then we can see the part of the mesiolingual cusp and the distolingual cusp, because mesiobuccal and distobuccal cusps are slightly smaller than these. So we see these two entities. Then going to the root trunk is about 3 mm in height, and we have two prominent roots, the mesial root and the distal root. The mesial root surface along the mesial line is convex till the middle. After in the apical third, it is inclined distally with a straight outline. So convex outline till the middle, after which there is a apical third inclination distally, which is straight line. The distal outline of the mesial root is concave. Similarly, the mesial outline of the distal root is concave. Then we have apical third distal inclination. Again, both go towards distally, and from the middle third to the cervical third, the root is outline is convex. So very clear, buccal surface. Then comes the lingual surface. Lingual surface is slightly different. We see the mesiolingual, distolingual, and a prominent mesial marginal ridge. Here, almost cervical line along the mesial surface, straight till the contact area, convex, where the mesiolingual cusp tip is formed at an obtuse angle. Then goes the lingual developmental groove, one single lingual developmental groove. Then we see the distolingual group and part of the distal cusp. And here the distal outline is fully convex, right from the occlusal tip to the cervical line, it is fully convex, whereas on the mesial surface it is straight. The mesial outline of the root is uniformly convex till the third, and then the distal outline is concave. Then for the distal root, it is straight in the mesial outline, then concave here in the apical third, then convex in the middle third, then a concavity. And both the roots are apically third inclined distally. That is the lingual surface of your mandibular first molar. To recapitulate the mesial surface, it is simple with a prominent mesiobuccal big cusp and a small mesiolingual cusp. The mesiolingual cusp is sharp and tall as compared to the broad, blunt mesiobuccal cusp. From the buccal outline, it is uniformly convex till the middle, after which it becomes concave to straight. There is a cervical ridge along the cervical line. So convex in the middle, till the middle, from the cervical to mid, it is convex, after which it is concave to straight. Then forms the mesiobuccal, broad, blunt mesiobuccal cusp separated by a mesial marginal groove. Then the mesiolingual groove, sharp and tall. The lingual outline is convex till the middle third, after which it is straight. The cervical line is flat. The mesial and distal, the buccal and lingual outline of the mesial root is uniformly convex. The center portion has a developmental depression. Note the prominence of the cervical ridge. The distal surface is more complicated than the mesial surface. We find all the 5 cusps here. We find along the buccal surface, lingual surface, The buccal outline is uniformly convex. We have a distomarginal groove that runs over the distal marginal ridge. Distal marginal ridge run over by the distal marginal groove. The prominent distal cusp and distolingual cusp are seen. Just below the distal marginal groove, we find a broad contact area. This is the buccal outline is entirely convex, whereas the lingual outline till the middle is straight, after which it is convex. We find the prominent distolingual developmental groove. We find all the cusp and the prominent mesial marginal ridge, because distal marginal ridge is placed little bit lower than the mesial marginal ridge. Coming to the root, you find a central developmental depression like your mesial thing. The buccal outline is convex for the distal root, whereas for the lingual root, it is straight and uniform taper. Straight and uniform taper towards the apex. That is the distal outline.
With that, we come to the end on the discussion of the mandibular first molar, a very important essay questions. It is important that you repeatedly draw this diagram, differentiate the cusp. So what are the fossa? Carefully repeated practice often helps in exams to speed up the answering part. So happy learning till we meet again. We'll meet again on another day with another question. Happy learning.